Hello again. This time I thought I will talk about something which is not very well known. I tried to do some subjects or topics where there is a new information coming in and it is sometimes knocking down our concepts of therapy in medicine. This one I'm going back several years or maybe several decades to talk about the treatment of asthma that was pretty much standard or was done for several years. And I can bet you that majority of the people listening to this video would not have ever even heard of it or imagined even being done. So the treatment of asthma that I'm talking about it is what is not underlined, what is not done today or rarely done in certain cases. So asthma is known to the mankind for a long time, and in early 1900 or 20th century, people started knowing about radiation, and to surprise that people had done radiation treatment for asthma. So there were reports published of cases that were treated with asthma. The two areas that I saw one was nasopharyngeal area, and then the large area of coverage was done in the whole chest and even belly or abdomen. So I'm not sure the concept of treating concept of treating asthma with radiation, especially to the abdomen. I can understand the nasopharynx and even the chest. It was interesting that some of the cases actually showed an improvement or reversal of asthma in many patients. The second one was that the 6,000 patients were treated. It was stopped in mid-60s actually. So in 1960s it was stopped. The success rate was good in the first few months to a year. Then it dropped, but overall success rate was still about 40%. But there was a fear of developing cancer related to the radiation, and the radiation treatment of either nasopharynx or of chest went out of favor, and nobody's doing it now. Nobody should even consider doing it now. So that was very interesting, that radiation treatment for asthma. The second one that I thought was a auto blood. Now there are a couple of ways the auto blood therapy was used. One was where they took a blood out of a larger vein, irradiated it or radiated it either with ultraviolet or the regular radiation, and put it back. This therapy was also quite a bit used, and it was thought that the treatment of the blood would change the antibodies, I guess, and that's how it was used. Again, this was not uncommon. Reports in the journals were there that how this is effective and works very well. Again, I have no known patient or a physician that either has had it done or a physician who is doing it or even implementing it. It was interesting. The concept was very, very interesting. Taking own blood out or the patient's blood out, and then killing the antibodies that were causing the asthma was the concept. Exactly opposite concept was there when auto blood was used to treat asthma in another way. This particular one was, I've seen it personally being done in India. And there was a couple of different ways that it was done. So a 1 cc of blood was taken out through the antecubital vein, or the one is in the arm here. And then it was split into 2 syringes or 2 shots, half a cc each. And each shot was given in each butt or the buttocks. And the concept was that giving an auto blood would create certain antibodies when it was given intramuscularly, and that would help or cure asthma. Again, I have truly no idea whether this is effective or not, whether this would even work or not. The second one that I saw was very rarely done is to mix something like a heavy metal into it, like tiny amounts of arsenic. That was not a common practice, but that was one of the thought out process of treating asthma. So the auto blood taken out and injected into butt was one of the concepts of treating asthma, and I have personally seen that being done in India. The one of the other concepts which is quite a bit here, or was here when I talked to the patient, was related to having a dog, a Chihuahua. Chihuahua is a small dog, as everybody knows. Apparently the Chihuahuas do get asthma. The concept was that if you adopt Chihuahua, then your asthma will go to Chihuahua and your asthma is cured. So this particular concept also existed about 20, 30 years ago. Some Mexicans and some people still believe in it. However, again, there is no control study to show whether the Chihuahua owners have a less incidence of asthma or not. But it was very interesting to me that asthma is not a contagious disease. And how can you transfer allergic immunological disease to a dog and then you don't have one? But again, the concept does exist. If you look and Google it, you will see people have talked about it. So owning a Chihuahua where Chihuahua gets the asthma and your asthma is gone was the concept. That was one. There are a couple of more concepts, and one of them is still legitimately used, but one that is still very commonly done in India, in a city called Hyderabad. South of it, I think, there is a town where there's a Gaud family on a particular full moon day give a particular fish, which is called muriac fish. It's about 2.5-inch size fish. Some people say it was stuffed with yellow color herbal stuff, and then you have to swallow the whole fish. Sometimes the children and people choke on it, and apparently that clears the asthma. But this concept on that particular day, literally thousands of people come there, especially even the police have to control the traffic. And I was told that even special buses are arranged to go to this place for that particular full moon day in India to swallow the fish so that you can cure the asthma. Now think about it, there are no proof, or there are no studies, or there is no proof that swallowing a fish, which is 2.5-inch in a particular one, apparently is called muriac fish, swallowing on only particular day in a full moon day cures the asthma. Now the family claims that they would not tell us the secret of what they are using with this particular fish, but people certainly believe in it, they feel it was beneficial and have done it. So swallowing a fish on a full moon day, especially in India, has been a treatment. Last but not the least that I'm going to tell you is we still use certain treatments, and I'm going to just mention the drugs and the names quickly. One is called Brethin, Brethin. Generic version is called terbutaline. Tablets of this, I personally used it. It's a very safe drug. It's also used for preventing threatened abortion. So in pregnancy, you could this is adrenergic type of drug, does cause some shakes and increase in heart rate, and does seem to open up the bronchial tube just like adrenaline would do it. And it is safe to use it in pregnancy. So you certainly can use tablets, or if there is a quick relief needed, shots. The second drug is theophylline, which is still commonly used, but still available but not commonly used. It was very commonly used several years ago. Literally 7, 8 different companies were marketing for it. Now we have a hard time getting the drug to use in case, because if we want to do it. The drug is effective and does work, but there are better drugs. Subsequently, theophylline has fallen off the wagon or favorite treatment. So these are the unusual, majority of these are dropped, not useful, not used treatment for asthma. I was doing this tape simply because I did one for treatment of asthma on another group. Thank you for watching. If you like, please subscribe. Have a nice day.